Hello everyone, how are you all? I hope that you all are doing great in your life. So today's topic is malaria and let's get into the class. So malaria is spread by the female Anopheles mosquito, as you already know, right? So female Anopheles mosquito is just not only responsible for it, it is the plasmodium that is reside inside the mosquito that is responsible for it. So now talking about the different types of plasmodium. So first one is the Plasmodium vivax, Plasmodium ovale, now Plasmodium malaria, Plasmodium falciparum and the Plasmodium novelsi, right? In this, the Plasmodium falciparum is the most dangerous one, right? And the Plasmodium ovale and the Plasmodium vivax is the very common, right? So these are the different types of common it is. There are 400 million people are affected worldwide and the 2 million deaths each year are happening with it. So we have to take preventive actions so that it will not spread of malaria. Now, when we are understanding the life cycle, there's three things are very important. First, we understand that there is the gametocytes and the sporozoites and the merozoites, right? So the human being is the secondary host and this primary host is the mosquito. So Plasmodium completes its cycle in two hosts. First one is the mosquito and the second one we human being, right? So what happened whenever any insect bite human being, then they releases the sporozoites that is present inside the salivary gland of the mosquito. It enters into the in the human being by the bite of this female Anopheles mosquito. Then the female Anopheles mosquito releases the sporozoite inside the human being. Now where they will go, the sporozoites then we enter into the liver cell of the human being. They will enter into the liver cell. Now when the sporozoites enter into the liver cell, they started to multiply inside the liver cell. This is also called the schizone phase, schizogony, right? Schizone formation is there. After a time, then what happens, the liver cells started to burst, and when these liver cells started to burst, they produces merozoites, right? Sporozoites, then come the merozoites. Now merozoites also started to replicate by asexual reproduction in the RBCs, right? For sporozoid, then enter the liver cell, and now coming to the RBCs. Now this RBCs, now they are started to multiply inside the RBC. Okay. Now what happens after a time, these RBC also going to burst because there is so much production of merozoites inside the RBC. Then when they releases the merozoites, they enter into the RBCs again, and some of the merozoites then enter into the they produces gametocytes, male and the female gametocytes, right? This is all about the asexual reproduction in the human. Now coming to the host, coming to this primary host, that is the mosquito. Now if any healthy mosquito, any healthy female Anopheles mosquito bite that infected person, they take up that gametocytes and these gametocytes enter into the mosquito gut. Now when they enter into the mosquito gut, they produces oocyst after the fertilization. Means these gametocytes do the fertilization, and then after the fertilization, zygote formation, then there's oocyst formation, and after this oocyst formation, then this produces again there is the sporozoites. Then these sporozoites again bite the human being, then the liver cell, then the RBCs, gametocytes, and then again. And this is the whole circle. This is the cycle. This cycle completes in two hosts. First one is the this mosquito, and the secondary one is the human, right? In human there is asexual reproduction. In this mosquito it is the sexual reproduction. Understood? Now when we talk about the symptoms, okay, in the next slide we will talk about the symptoms. Now you correlate these symptoms with the pathophysiology, right? Now you better understand this topic. Okay, now coming to the, when we are talking about the symptoms, first one is the fever. The patient को fever आएगा with chills, ठीक है, ठंड लग के उसको बुखार आएगा. Whenever the patient comes to the hospital, and if they are diagnosed with malaria, then they always say you that okay, I have मुझे ठंड लग के बुखार आ रहा है, ठीक है. Then patient को sweating होगी. स्वेटिंग होने के बाद, और जब भी फीवर विद चिल्स होता है, मीन्स चिल्स क्यों हो रहा है पेशेंट को, ठीक है, व्हाई देयर इज चिल्स, बिकॉज व्हेनेवर देयर इज द आरबीसी ब्रेक डाउन, देयर इज द हेमोजोइन chemical is produced over there, and because of that hemozoin chemicals are producing, then there's a chills is there. Okay, now coming to the headache. The patient को जब भी ये सब है, the patient को headache होगी, because so much weight loss होगा patient को. There may be hemolytic anemia. Why? Because the RBC is breaking down here, and there is jaundice is there, and there is because the liver is infected here. Okay, liver cells are bursting out, right? So there is a large number of these merozoites are producing inside the liver cells, so the liver is affected now. So there is the jaundice, and this thing will be there. Okay, now the patient having platelet level, hemoglobin level, WBC, everything is going to disturb, and the patient is having diaphoresis. Diaphoresis means there is a lot of sweating is there. Okay, these are about the symptoms. Now you can better understand the signs and symptoms when you correlate with the pathophysiology. Okay, now coming to the diagnosis, how we will diagnose that it is malaria or it is dengue or it is. So coming to the diagnosis, how you will make the diagnosis? We make the diagnosis by doing the lab investigation. First is the rapid diagnostic test. There is a kit available, and you get the results in 15 minutes, but it doesn't tell you about the which type of species of plasmodium is there, and what amount about the quantity also. Okay, so it just tell about the it is there or not. Okay, now when you go to the detail, then there is a, we are doing the blood smears. There are thin blood smears and the thick one. The thick blood smears are thick blood smears tell about the presence of parasites. Okay, the presence of parasite, and the thin blood smears are the confirmatory tests. They tell about the type of parasites and the quantity. Okay, so if these thick blood smears or the thin blood smears are coming negative, we have to check 3 times in 12 to 24 hours. If it is negative, then malaria rule out. Okay, now in CBC, what you will see, in CBC there is a hemoglobin level is going to decrease, there is a platelet is also going to decrease, there is increased LDH level. Why? Because when these parasites are present in the RBCs, and whenever there is RBC rupture, there is the LDH production is there, and there is an increased LDH level, lactate dehydrogenase. Okay, this is LDH means lactate dehydrogenase, and there is leukocytopenia. WBC level is also going to decrease. So you will see that by the CBC that these things are there whenever there is malaria. Okay, now we are coming to the treatment part, and then the prevention. Talking about the treatment part, there we divide it into non-falciparum and the falciparum. In the non-falciparum, we are giving chloroquine to the patients. Okay, and next is the we are giving this primaquine also. Always we should give the primaquine, because this Plasmodium vivax and the plasma always present in the liver cells. So to kill that cyzones that is present in the liver cell, we have to give the primaquine, right? So in the non-falciparum we are giving chloroquine, but think if the chloroquine resistant is there, so we are giving this drug to the patient, right? Now coming to the falciparum part. In the falciparum, we are giving this drug, and this is it should be taken with the high fat diet to increase the absorption, right? So now अब ये देखना है कि how to prevent it. ठीक है, सब कुछ पढ़ लिया. Now अब देखते हैं कि prevention कैसे, और सब जगह पोस्टर लगे हैं आजकल, सबको पता है कि कैसे prevent करना है. Okay, cover the naked areas, right? Cover your arms, legs, wear socks, shoes. Okay, and use insect repellents. And whenever you're traveling to the any country or any places where there's malaria prone countries, there use anti-malarial drugs. That's all about this topic. I hope that this video gives a lot of good pointers, and if I make you understand this topic, please let me know in the comment section. And till now, bye bye, see you in the next video.